Well, hello, everyone. Welcome to the Justice Coordinating Council Speaking Series. And my name is Kara Nelson. I'm the Principal and Strategic Advisor for KLN Consulting. I'm also a founding member of the Justice Coordinating Council, aka JCC. I'm honored to be with you today as moderator for what will be a dynamic and empowering conversation as part of the JCC's Federal Speaking Series. The JCC, as many of you know, is the first of its kind national policy table created by and for individuals impacted by the criminal legal system. Over the course of the last 3 years, we have built a table where everyone is welcome and all who are invited have a seat. This is a table where collectively we can leverage our lived experience as the expertise that it is. Today's speaker series is a topic that comes at a critical time for our country. Even as we celebrate advancing fair chances during Second Chance Month, we do so with the looming realization that public benefits, as we know them, are and will continue to change in drastic ways. These changes already are being felt across the country, impacting vulnerable communities of all kinds, including those impacted by the criminal legal system. Re-entry is one of the most vulnerable experiences an individual can face. As such, it is up to each of us to meet this moment head on, both through educating ourselves and our peers, as well as advocating for the least restrictive choices at the state level, to prepare our coalition for the necessary actions needed to preserve access to human needs. We are hosting today the first part of a 2-part series focused exclusively on state policy implementation and how we as advocates can and must begin including these efforts in our engagement. And again, welcome. And I would love to have you put your name, where you're from, and also an organization, if you are with an organization, in the chat, and our chat will be monitored, and we would love to hear from you along the way. Today, I am joined by 2 experts from national organizations who work tirelessly to advocate for full access to food, medicine, and related benefits and assistance. I'd like to welcome Gina Platanino from the Food Research and Action Center, and Teresa Miller from the Legal Action Center. Welcome. These experts will be highlighting critical changes ushered in last year by the passage of H.R. 1 at the federal level. In addition, they will also share technical processes and strategies that those on this call can leverage in ways that help ensure continued coverage for those working toward reintegration. The decisions made at the federal level are already shaping the playbook, but opportunity remains for advocates to reduce harms through developing deeper understanding of these policies and taking action. Before we dive into today's session, I want to take a moment to orientate those of you joining today of exactly why the JCC is truly a first of its kind. The JCC is truly a first of its kind approach to policy. In April 2023, the Justice Coordinating Council, JCC, was launched, a national collective led by systems impacted leaders, community members, and national organizations who no longer demand a seat at the table, but instead are building our own. Next slide. The voices of those most impacted by the criminal legal system have been missing and or excluded from decision-making tables. Next slide. Next slide. To adequately start addressing the harms caused by the criminal legal system, the JCC works to create pathways, access, and resources within each of these policy areas. Our mission is to enhance quality of life for justice-impacted individuals and their communities in order to restore human dignity. We do this by dismantling the policies that uphold marginalization and are ineffective. Today's focus, access to health and well-being, is one of the most important aspects of reentry and one that faces new challenges. Today's session centers on those most impacted as we highlight new policies and resources, explore advocacy opportunities, and connect with policymakers and advocates advancing change. And that's what brings us here today. As I mentioned, the JCC was founded on a new vision of economic opportunity and justice, where all systems impacted individuals can thrive. Not only does this require investment and new pathways to training, education, and employment, it also requires making sure we as persons with lived experience have access to the resources to meet basic needs that allow us to thrive and live healthy. Since 1970, the Food Research and Action Center has been at the forefront of the fight for nutrition access. Their advocacy has influenced campaigns spanning from breakfast in schools to nutrition for seniors. And through an approach that blends legislative and administrative policy advocacy, they continue to advance their agenda and end hunger in America. Gina Plata-Nino serves as Director of SNAP Policy and Advocacy. Previously, she served as a Senior Policy Advisor for Nutrition and Agriculture in the Biden-Harris administration's Domestic Policy Council, where she helped lead the National Strategy on Hunger, Nutrition, and Health. In this role, she worked with federal agencies and private stakeholders to advance the goal of ending hunger and diet-related diseases by 2030. At FRAC, Gina collaborates with the SNAP team to improve the program's reach and effectiveness for low-income households. She leads legislative and technical support efforts for national, state, and community organizations, as well as government agencies and nonprofits to help SNAP access benefits and customer service. Gina, welcome to our JCC Speaker Series. I'm so glad you're here. The floor is yours.
Thank you, Cara, so much. And if you get anything out of that, just know that I'm here as a resource. I am here to learn from you. I am here to support your work. And I am thrilled for the advocacy of people like Cara and JLCC and the work that you do. So let's get started. The slides will be shared. My email will be there if you have any follow-up questions. So excited to talk about this issue. Next slide, please. Cara did a great job talking about us. One thing I will say that the way we define hunger is it's poverty related. If we address those issues, such as people's opportunity to be able to access shelter, livable wages, and all of these pieces, healthcare, and everything that we need in order to be a society that thrives, we wouldn't have hunger. We are the wealthiest country on this earth, and it really is about political will. So we're going to talk about the program, what happened after HR 1, and what you can do and what you could be aware of how HR 1 may be impacting ways and budgets to be able to provide more support for the issues that you care about. Next slide. First of all, SNAP matters. It is an economic engine. It is the difference between individuals being able to put food on the table, not having to choose between shelter and food, childcare and food, medicine and food. And not only does it reduce hunger, but it allows people to have the economic mobility. When we talk about how impactful it is millions of individuals who are in this program, with the biggest beneficiaries being children, followed by older adults, followed by people with disabilities. 80% of people who are in SNAP have a household of someone that is working. And they are just, SNAP allows you to get away from that poverty threshold and ensure that you have resources to enjoy economic mobility. Next slide. SNAP also bolsters local economies. What do we mean by that? For every dollar spent, there's $1.80 that stays in local economy. If we look at just at the small grocers, not the national retailers, last year, SNAP brought in almost $12 percent of grocery sales, almost 250,000 jobs, almost 16 billion in wages, right? Because it's the people who, the cashiers, is the people who manage the stores, and 1 billion in federal taxes, and almost 1 million in state and local taxes. And all of this is incredibly local. A lot of the individuals who are BT retailers serve as something that we call high need, low access, meaning that there's a lot of need, people who need food, and they're the only ones. When 50% of their income comes from SNAP beneficiaries, and 3% it's your profit margin, any sort of shift can have an impact. So grocers, local retailers could be a great advocate in your work to talk about the economic impact, because when their doors close, it also means that there are less local taxes to be able to address some innovations that your city, or needs that your city may need. Next slide. We appreciate the role that food pantries really create. But in context, think about that. We used to have food kitchens back in the 80s. And because the Reagan administration instituted really terrible restrictions on SNAP, unemployment, childcare, just think as a whole, all economic mobility programs that help individuals, it created a hunger crisis in America, that we went from having soup kitchens to having a dedicated program, a disaster program to address hunger in America. Which is where the food banks came from. But they were supposed to be a disaster, a one-time. Unfortunately, because of the lack of disinvestment and cash programs, and how expensive housing is, and how the attacks on SNAP, and how expensive grocery prices are, food pantries have become a day-to-day asset for individuals, which is not sustainable. For every meal that these wonderful volunteers provide, SNAP provides 9. Next slide. What do we know about our returning citizens who are in our community and food insecurity? We do know that more than 500,000 are released each year. We do know that they face even more burdens than other populations, including housing instability, employment, and poverty, and that increases based on race. We do know that they have limited or uncertain access to adequate food. We do know that depending on your state, the services that you receive and the way that you're able to integrate and receive these programs varies, and that there are more additional barriers. We know that this population is twice more likely to be food insecure than the general population, and that one in 5 formerly incarcerated people struggle to obtain regular meals. And there's a disproportionate impact because of the structural and systemic racism that our country has experienced on Black individuals and adult 55 plus. And the folks here who run these webinars are the experts on how our criminal system really is has had a lot of issues, and how it disproportionately targets communities of color. So you understand the context. But we do know that as a result of these barriers and access issues, families absorb the burden as limited food budgets are stretched further. Next slide. So what happened in 96? 96 was this idea, this contract for America, where President Clinton, then a Democrat, really, and Republicans, Newt Gingrich was the speaker, really wanted to say, we need to fix these economic mobility programs. We need to address them. They hadn't learned the lesson from the 80s as to what happened when they impacted these programs and how hunger rose. And so in 96, it was a package of different legislations. The legislation pretty much allowed then the Republican-controlled House to pretty much dictate what the policies were going to be. And cause policies that we're still struggling with. One of them is the SNAP drug felony ban. Right? As part of the Personal Responsibility Act, this law was instituted to deny SNAP to any individual with a drug felony conviction. This was part of the war on drugs. And we do know that that had disparate racial impacts. And we know that across the country, we still have a big amount of states that have a full-time ban, and other states who utilize modified bans, which are burdensome and create access issues for individuals. And it misses the fact that SNAP is a core anti-poverty program that supports being able to re-enter society and have the resources to be able to succeed. And we do know that almost more than 60% of returning citizens are unemployed 1 year after the release. And that causes a lot of issues, particularly when you don't have food that you can access food. And we do know that SNAP's access is linked to lower recidivism and improved stability. Next slide. So with this context, in terms of the barriers that this community is experiencing, let's go back to last summer. Under the reconciliation law, which was an exchange to make permanent the taxes that President Trump had pushed in 2017 to ensure that very billionaires, and that distinction needs to be very clear, because we're not talking about high income earners. It's like the top 10% of billionaires could keep their tax breaks, and also corporations who paid less taxes than many of us who felt the pain last week of submitting taxes. In order to make all of these permanent taxes permanent, these tax rates permanent, you needed to take the money out. The money came out of our programs. I know my colleagues going to speak about the healthcare aspect, 1 trillion. I'm going to talk about SNAP, but there were also other provisions there that really harm communities as a whole. SNAP, we got almost $187 billion worth of cuts. This is worse than the Reagan administration and worse than the Clinton administration. And if anything that has taught us from both the Reagan and the Clinton administration is that it is a lot easier to prevent things from happening than it is to restore. You'll see an underlying theme as we go back to 96 that we have been trying for 30 years to offset and repair some of the harm that was caused. And so there are going to be opportunities now for us to do this. So 30 years from now, I really hope we're not having the same conversation to say, and we're still trying to restore this, because it really does take concerted effort to push back about what was spent on those economic disparate impacts that went to the wealthiest corporations and billionaires. We could have ended poverty in America. We could have provided shelter, childcare, so many positive things. And I'll share some resources as to really what happened from an economic and tax implications impact. So part of the bill in terms of SNAP, it defunded SNAP education, right? That cost people jobs, impacted outreach, the way that individuals were being able to taught about access and nutrition. And it's interestingly enough, because this is an administration that says that they're going to make us healthy again, but at the same time, they're going to cut all core programs that ensure economic mobility and stability. It expanded time limits. I'm going to go into detail about those time limits after the slide and in terms of like what it means, because it's so complex. It took away the internet cost exclusion, which meant that internet has become a service that individuals need, and that would have meant the SNAP benefits more adequate. It took that away, and it makes it harder for individuals who are not older adults, for SNAP is 60 plus, and people with disabilities to access, to prove their utility expenses. So now people have to jump through additional hoops to show their utility expenses. And it cut non-citizens who are legally here, which meant that humanitarian-based individuals such as asylees, refugees, victims of trafficking, no longer are eligible for SNAP unless they have a green card. And so these individuals were automatically cut, not just from SNAP, but from healthcare as well, even children. And then the Thrifty Food Plan, which is how we get the number of the SNAP benefits, that is going to be cost neutral, meaning that regardless that our fuel prices are $5, regardless that the price of eggs, beef, milk, vegetables has quadrupled since this administration has taken place, it doesn't matter. The amount will stay the same, which weakens the power of this benefit. Right now, we used to say a year ago the SNAP benefits were about $6 a day. I don't necessarily think that anymore, because how expensive everything is. It really does, its impact is not as wide, but it's an incredibly pivotal program because it's the one solution that we do have, that we know that it works. So all of these provisions means that state agencies have to do so much work. And all of this work means new provisions, new policy trainings that increase administrative costs. But beginning this fiscal year, meaning this October 1st, state agencies now are going to pay an additional 25% in administrative costs in order to operate the program. We are hearing from many states across the country that people are getting laid off, that states don't have this in their budgets. And we are concerned because if states cannot lower down their payment error rates below 6%, which will take time, they will begin to pay a partial benefit share of their benefit costs beginning in FY28, which will be incredibly detrimental. Next slide. The actions that have already been taken since January of 2025, we can see that have led to a steep decline of policy actions, from eliminating diversity equity programs, ensuring that there was equity outreach within the spaces, selling of data of information, sharing data so that it is not protected, that there was a decrease between June and July. But as you can see in the graph, all of these actions from July then on to December, we have a total of 3.3 million people who are now have less access to SNAP because they have been cut off the program. New jobs have not been created. We actually have been at a standstill in terms of job creation. We know that individuals' economic circumstances did not improve. It's that the systems change and all of these rules were implemented, and so less individuals now have access to SNAP, and this number will continue to grow, as we have seen in history past, that because of the access barriers. Next slide, please. And it's not just what we are seeing in terms of individuals, it's also having an economic impact. The National Grocers Association estimates that we expect an 8.7% average to fall with these SNAP cuts, which comes out to about almost 88 billion less that we're going to a local economy. This means because less people are accessing SNAP, less people have resources, more people are being cut off. It is a local economy, so we're also going to feel it. And so we are going to have less resources. And it's not just SNAP recipients who are impacted, it is communities and society as a whole, because when that store closes, that means that people have to drive longer, putting an additional price tax on food in terms of having to more travel, more gas. Next slide. And I talked about what the benefit cost share is. So take a look at, for example, a state like California and New York. They're facing over 1 billion, almost 2 billion. California is a lot higher. They're a bigger state in terms of new expenses that they have to come up with. North Dakota, additional funding that could have gone to other innovations, that could have gone to reentry programs, that could have gone to housing, that could have gone, but now states have to come up with additional sources in order to offset. And the one that we're first dealing with is the state administrative costs, like which I said, states have to put in more when historically they have not necessarily invested in state capacity to administer SNAP, which is one of the reasons that we're seeing such a decline in SNAP participation. Next slide. And we are concerned that based on these costs, some states may not be able to participate in SNAP, as the Congressional Budget Office has said. And it doesn't mean that there won't be hunger in America. Children's Health Watch did an analysis and show that hunger and poverty cost over 190 billion a year. And that is because that creates a weaker workforce. It creates disciplinary issues in kids who can't concentrate, which not allows them to complete school. It creates more ER visits. It creates more hospitalization because the worst health outcome is hunger. And what you need to understand is that SNAP has never been part of a state budget. The main things that drive state budgets are healthcare, K-12 education, higher education, and it decreases as such. This time, your state is trying to figure out within their framework, how do they add an additional program that they need to fund? And so they're making really difficult choices in order to address this. FRAC has a policy playbook on progressive tax policy and ways that states can do this without cutting access, but instead staying away from regressive taxes that harm individuals, but taxing those who have more. So happy to include that as a resource. So when you talk to your state legislator and individuals, just keep in mind that you're going to have to advocate for your programs because healthcare now is asking for more money. SNAP is part of the state budget, so there are going to be a lot more resources needed. Next slide. With less funds coming in. And Moody Analytics says that we have a growing concern over a recession, meaning no more income revenue coming in, and that looks like across the country. And this needs to be updated because we do know that the war in Iran is causing more chaos, and states are really starting to feel this with fuel prices, food prices, which are impacted by fertilizer. We're going to see more states scrambling, and we are tracking to see what that impact is going to be, which means, again, states are less likely to want to negotiate more resources for economic mobility programs, but we need to advocate that they do so and that they prioritize these programs. Next slide. I talked about that. I said I was going to go over, and I'll finalize with these slides. The time limits. Time limits are this provision that says that it's full of racial tropes, stereotypes, that people on SNAP are not working and so on, and a misunderstanding who is on SNAP. The biggest population at SNAP back then and now was our white population, and then half of that almost is our Black population and their Latina population. But SNAP has always had work requirements. They've always had it from the beginning. It requires people to register. They can't quit a job, and they have to accept a job. Next slide. What happened in 1996, as I said, as a contract in America, not only did we the ban on people re-entering, accessing SNAP, but it also implemented time limits, which means that individuals can only get SNAP for 3 months in a 3-year period if they can document. And the key focus is document 20 hours of work a week. We do know that most individuals are working. It's just showing. It doesn't take into account that maybe you're commuting to your job 4 hours a day, or that you don't have transportation, or that there are barriers, or that there are no jobs around you. It doesn't take into account any of those pieces. And while President Bill Clinton did say that he was concerned about it, unfortunately, no action steps were taken to reverse this awful harm. Next slide. Even on the other side, who was responsible for pushing this forward, they did say that this was supposed to be if you're able-bodied and if you're childless. Yet HR 1 expands this to parents, caretakers with children 14 and up, as if children 14, 15, 16, 17, 18 stop being children because of this rule. And if you live in an area where you're getting SNAP and there are jobs available, we do know that there are no jobs available in many areas, but HR 1 has also taken the state's ability to be able to waive whole areas if they have insufficient jobs. Next slide. I already talked about this part, so we're just going to go ahead and move forward. At that time, it used to be for individuals 18 to 49. The Personal Responsibility Act expanded this to individuals 18 to 54. And when that expansion happened, we lost almost 700,000 people lost access to SNAP. We have 30 years of data showing that these time limits don't work. All they do is create burden on the state agencies, burden on individuals, and just create a more hungrier and poorer community. Some exemptions that were added in 2023 was that it exempted veterans, unhoused individuals, and youth aging out of foster care. Next slide. HR 1 expanded this even further. Now is adults up to age 65. Like I said, it includes parents and grandparents and caregivers of children 14 and older. It took away the protection from our unsheltered folks, from our veterans, from our youth aging out of foster care. Their circumstances have not changed. They actually have gotten worse. And at such a time, they're only going to be able to get SNAP for 3 months in a 3-year period if they can document sufficient hours. And we do know that because of these tax cuts that have happened, state agencies are not picking up the phone because they don't have sufficient staff. So even when people are meeting these time requirements, they can't get SNAP because they are getting cut off. I also have some data in there so that you could show that we're particularly concerned about older adults, as nearly 2/3 of workers in their early 50s are forced out of full-time jobs before retirement. Next slide, please. There are certain exemptions, and happy to dig in if there are questions, but we do know that exemptions only work if you are able to get to the phone and are able to speak to someone. And I will mention that disability is an exemption, but we do know that a high majority of people with a disability are still cut off SNAP because they can't prove it. So that is an access issue. Next slide. The impacts of the cuts, according to the Office of Management and Budget, is that an average month, we're going to see adults through the age of 64 who don't live with children, about 800,000 losing SNAP. Almost over 300 of those who live with children 14 and older who will lose their SNAP benefits, and roughly 1 million 18 to 54 who will also lose SNAP benefits. Next slide. This is a data hub that we have on all of this very specific data, and we are working on a fact sheet that will come out soon on best practices to help the community reentering, specifically, and how they are impacted on HR1. Thank you.
Thank you, Gina. Wow, that was incredibly informative and up-to-date data that I will definitely be looking over again, and I'm sure anyone who watches this. Thank you so much. For everyone in attendance, please feel free to use the chat button to ask additional questions of our speakers today. We will answer your questions both in the chat and in real time before we end today's session. Next up is Teresa Miller from the Legal Action Center. The Legal Action Center fights for the rights of people who use drugs, are in recovery, are living with HIV, AIDS, or mental health conditions, and people with arrest or conviction records. They work to combat discrimination and advocate for equitable health outcomes to drastically shrink the reach and harm of the criminal legal system. Over the last year, they have published a number of strategy advocacy materials geared at educating the field on the current and coming impacts from the passage of HR1 as it relates to continuity of care in reentry and recovery. Teresa, thank you so much for joining us today. We look forward to learning from you.
Thanks so much. Thanks so much for inviting me to be a part of this really important conversation. It is just such a pleasure to be in community with all of you today. These are really challenging times, as you just heard, but I know I find strength by being in spaces like this. So thank you for being here and for all the important work that you do every day. We can go to the next slide. For those who are not familiar with the Legal Action Center, Kara gave a brief interview. We use legal and policy strategies to fight discrimination, build health equity, and restore opportunity for people with arrest conviction records, substance use disorders, and HIV and AIDS. We are headquartered in New York, and we do provide direct legal services to New York residents, but we also do policy work both in New York as well as nationally. I work in our small but mighty DC office doing national policy work. And recently, we've been really focused on Medicaid, as this program has been and just really continues to be the target of massive cuts and policy changes that we're going to discuss today. We can go to the next slide. So I want to spend just a few minutes level setting with some Medicaid basics. So Medicaid is a federal-state partnership where the federal government, through laws and regulations, sets the parameters for the program, and then states administer the program, and they have flexibility to establish their own eligibility criteria and determine covered services, how services will be paid for, all within, of course, the federal guardrails. Next slide. So traditional Medicaid covers low-income individuals who meet certain categories. So this would include children, people with disabilities, pregnant people, people with dependent children, etc. But historically, someone who didn't meet one of those categories but was just low income would not have been able to access Medicaid. But the Affordable Care Act, which passed in 2010, opened up an opportunity for states to expand Medicaid eligibility to include nearly all adults, so people outside of those traditional categories with incomes up to 138% of the federal poverty level. So this was huge. This expanded access to more than 20 million people across the country. So when we talk about the Medicaid, you'll hear me a lot today talk about the Medicaid expansion population. When we talk about that population, we're talking about these individuals who gained access to Medicaid following passage of the ACA and states then expanding Medicaid. So on this slide, this population is represented by this little person wearing a tie. And you'll hear people refer to individuals as low-income adults without dependents to, again, reference that Medicaid expansion population. Next slide. So this expansion of Medicaid allowed millions of people leaving incarceration who were not previously eligible for Medicaid to now qualify for coverage. And states receive enhanced federal matching funds for expansion enrollees. So the federal government pays 90% of costs for expansion enrollees, which is a huge incentive for states to expand eligibility. And yet, not all states have done so. So to date, we have 41 states, including the District of Columbia, that have opted to expand eligibility. And you can see on this slide the 10 states who have opted not to do so far. The bulk of what I'll be talking about today primarily impacts those states that expanded Medicaid, because the majority of the Medicaid cuts and policy changes that we're going to talk about are targeted at the Medicaid expansion population. This bill that passed last year that we're going to talk a lot about, it really targeted that population for cuts and policy changes. Next slide. Medicaid is a critically important program that provides access to healthcare for more than 70 million people in the US. One important thing to note is that Medicaid is not always called Medicaid. Since states administer the program, many have different names for it. I'm originally from Oregon, where it's called the Oregon Health Plan. And the reason this is important is because someone may be on Medicaid and not know it. They may not know they need to be concerned about Medicaid work requirements, for example, because if they're in Arizona, they're on Access. That's how they're going to know it. And Access is an acronym for the Arizona Healthcare Cost Containment System. And many people there may not realize that that is Arizona's Medicaid program. So it's just important to know what Medicaid is called in your state so you can effectively communicate about the program. Next slide. Medicaid is a critical support for formerly incarcerated individuals, as it is the largest funder of mental health and substance use disorder services in the country. And it provides more comprehensive coverage of those services than most other insurance. And you have a number of states that have pursued and some received Medicaid reentry waivers, because they want to make it easier to connect people to coverage as they're leaving incarceration. So this is just a really important support for people leaving incarceration. Next slide. Okay, so with that background, let's talk about the massive cuts and changes coming to Medicaid as a result of this big, ugly bill that passed last year. This new law cuts nearly $1 trillion from Medicaid over the next decade. And importantly, almost a third of those cuts come from one single provision in the law, this new work reporting requirement. Next slide. The Nonpartisan Congressional Budget Office projects that 7.5 million people are going to lose Medicaid by 2034 as a result of this law. And more than 5 million of those losses are attributed to that one provision, that work reporting requirement alone. Next slide. So I'm going to spend the rest of my presentation really talking about this work reporting requirement, because as we just saw, it's going to have the most significant impact in terms of coverage losses. I do just want to note, though, that there are several provisions in the law that target the Medicaid expansion population, as I mentioned earlier. There are provisions that are going to require certain expansion enrollees to pay a share of the costs of certain services. And there's more frequent eligibility determinations. These provisions are going to result in coverage losses and people foregoing services. But I'm going to focus on the work reporting requirement just because of the enormous impact it's going to have alone, and the opportunity that exists to mitigate the harm if we all kind of collectively take action now. Next slide. So let's talk about this new work requirement. For most states, this is going to go into effect on January 1st of 2027, next year. There are a few states that are aiming to implement sooner than that. Nebraska, for example, is planning to implement, and they are going to be implementing May 1st. So that's just next week. But the vast majority of states are going to be implementing beginning in 2027. Again, this impacts the expansion population that we talked about. Individuals age 19 to 64 who have Medicaid or want to enroll in the coverage via Medicaid expansion, they're going to have to complete 80 hours of work per month, or activities like job training, community service, or education, or seek an exemption from the requirement. Another way people can be in compliance with the requirement is if they have monthly income of at least $580, which is the federal minimum wage multiplied by 80 hours. Now, this is important for states that have higher minimum wages, because in those states, people won't have to work as many hours to be in compliance. So we just like to flag that as an alternative way to comply. Next slide. So this slide summarizes the history of harm of work reporting requirements that is well documented. When Arizona implemented work requirements for Medicaid during the first Trump administration, they saw 1 in 4 people lose coverage, and that was in less than a year of them implementing the requirement, with no increase in employment. And in Georgia, and Georgia right now is the only state that has a current requirement, they've seen a very small percentage of people who are eligible access what's called in Georgia their Pathways program. And at least that's in part because there's a work requirement on the front end before people can access the program, which is similar to the requirement that is now going to be a national requirement. I do think it's always important to point out, as we talk about work reporting requirements, that, and Gina mentioned this too, the concern is not about these provisions. The concern is not about people enrolled in Medicaid working. Most already do, just like in SNAP. And those that don't will qualify for an exemption. The concern is that this new law is going to require people to navigate bureaucratic processes to prove that they're meeting the requirement or qualify for an exemption. And it's that process of proving these things that results in so many people who are eligible losing coverage. And for justice-involved individuals who already face significant discrimination and barriers in rebuilding their lives, this burden is going to be especially pronounced. Next slide. The new law is very explicit about the exemptions from these requirements. There are a number of exemptions spelled out in the law, including for individuals with substance use disorders, disabling mental health conditions, disabilities, serious or complex medical conditions, people who are released from incarceration in the last 3 months, individuals who are already complying with TANF or SNAP work requirements, as well as others. Now, while states are going to be determining who falls into these categories, states don't have the flexibility in terms of the categories themselves. So the law doesn't provide flexibility, for example, for states to add additional exemptions. Next slide. So there's a lot of considerations around reentry that we want to put on your radar, and we can all be thinking about and hopefully taking action on. So as we've discussed, this provision is going to have a huge impact on people leaving incarceration because most of them are going to be subject to the work requirement because they're going to be covered through expansion. And of course, we know they're going to face significant barriers to employment. The reentry exemption that I mentioned is very limited, but we know that the vast majority of people leaving incarceration have a substance use disorder, a mental health condition, or other medical condition. And we really see this as the opportunity to protect this population. Having said that, it's going to take some planning and preparation for that to happen. And so I'm going to talk more about that in a minute. Next slide. As we think about how to mitigate the harm of work requirements, we've been focused on 2 broad goals: maximizing the exemptions and minimizing the burdens of compliance. And I just want to repeat what I said earlier. Our focus on exemptions is not to suggest that people with substance use disorder or justice involvement can't work, don't want to work. It's just a recognition that these reporting requirements are designed for people to fail. So our goal is to maximize ways for people to keep their coverage. Next slide. One way that states can help mitigate coverage losses is to maximize the use of exemptions. And for the reentry population, this means finding longer-term exemptions and not just relying on that 3-month post-incarceration exemption. And it means putting in place processes and procedures to protect coverage for those leaving incarceration. Carceral settings should be screening for and documenting health conditions that might qualify individuals for longer-term exemptions. And if an individual is not eligible for another exemption, then they should automatically receive that 3-month reentry exemption. Next slide. States also need to work hard to minimize the burdens of compliance. When you look at states that have implemented requirements for Medicaid, people typically lose coverage when they're still eligible because of paperwork and reporting burdens. The law actually has some helpful language included that requires states to establish processes and use reliable information available to the state, things like payroll data, Medicaid claims data, without requiring individuals to submit additional information. And this is something that CMS, the agency that is implementing this law, they've been pushing states to look for all available data and to tap into that information for this purpose. One thing states, though, could be doing now is ensuring that the Medicaid agency can match data from the criminal legal system that might show that someone in reentry has a medical condition that could provide them an exemption. This is going to be the most effective way to protect people, using existing data and automatically exempting people from the requirements without requiring any action on their part. Those who are not captured through data matching should be able to complete a medical screening tool or otherwise attest to meeting the exemption criteria. If a third party is necessary, hopefully it won't be, but if it is, the state should automate that third-party verification process as much as possible. And at the very least, carceral settings should be giving individuals hard copies of medical records or any documents that would allow a reentry provider or other organization to help facilitate that access to care and coverage. But I just want to emphasize that the best way to protect people is for Medicaid to be able to access existing data and automatically exempt people. There are a lot of opportunities to work at the state and local level to mitigate the coverage losses for this population. But as I said, particularly when we're talking about things like data matching, the solutions aren't necessarily going to be easy and they're going to take some time, which is why it's important for us to be raising these issues now. Next slide. What we know today about this provision is what's in the law. We're still waiting for the federal government to issue their required implementing regulations that are due by June. So there are still a number of outstanding questions, probably on your minds now, that we're hoping are going to be answered in these regulations, particularly around what's called the medically frail exemption. We've not seen any written guidance about how these requirements are going to be implemented, but in a pretty unprecedented way, CMS has actually been pretty open about how they're thinking about things as they talk to states and other stakeholders. So we do have a sense of where things are headed, with just a huge caveat that none of this is in writing. But what they've been signaling through a lot of conversations is that when people are initially applying for coverage, states can decide whether they want to use a medical screener, which would probably be part of the application, to identify people who might be exempt because of a medical condition, or whether they want to require documentation of a medical condition. So this is an area that we're going to see some state variation. We would certainly encourage states to simply use a medical screening tool, because every additional piece of documentation, every additional hoop someone has to jump through just creates more opportunity for people to fall through the cracks. Once someone's enrolled, CMS has been saying that states are going to need to verify a person's exemption status in the first 6 months through either Medicaid claims data or other documentation that would confirm someone's condition. They've even said that states are going to need to continue verifying exemption status either every 6 or 12 months, depending on the condition. Now, I just want to point out, we believe this approach to verifying exemption status, specifically requiring states to do this, is not consistent with the language of the law. And we've been more than once, we've told CMS that we don't think this is consistent with the statute. But since this is what they're saying that they plan to do and what we may see in the regulation when it comes out, we want to be prepared. Next slide. And this slide just explains why this approach of relying on claims or other documentation is so problematic, particularly for people with substance use disorders or mental health conditions. Only 1 in 5 people with a substance use disorder receive treatment in a given year. 80% do not. And more than 95% of people with a substance use disorder who don't receive treatment don't think they need it. So this means the vast majority of people with a substance use disorder are likely not going to have Medicaid claims or other documentation verifying their condition. This is another point we've been making with CMS and urging them to rethink this approach, but something we're concerned about. Next slide. So how can you help? If you're in a position to engage with your state Medicaid agency or carceral facilities, talk to them about how they're planning to protect people leaving incarceration from this new requirement. Carceral settings, as I mentioned, they should be screening people and documenting medical conditions and then ensuring that the Medicaid agency has access to that information so people can be automatically exempted from the work requirement. And if you have the opportunity, connect individuals with healthcare providers so they have the necessary claims data or formal documentation needed to qualify for the exemptions. The goal here is to really set people up to be automatically exempted from the requirement without having to submit additional information or take additional steps that are going to leave them vulnerable to losing coverage. Next slide. In this resource slide, we included links to various resources that talk about these changes and how we can all work to protect Medicaid coverage for people leaving incarceration. So hopefully these will be helpful. But I just appreciate the opportunity to be here with you today. You have my contact information. Don't hesitate to reach out if there's anything we can do to support your work, if you have questions or just want to talk through any of this further. Thanks.
Thank you so much, Teresa. And again, so much great data, real-time information. I love how both you and Gina have really given us some great approaches for our state and how we can really dive in deeper. And I really want to go into questions right now with the audience. And also, I just want to let everyone know we will be distributing all of the slides. And if you have any further questions after, you can get a hold of us. Were there any questions from the audience? And Teresa, just while we're waiting, if there's anyone that does have any questions, you know, it's so disorientating, the landscape for advocates who work in legislative arenas. And for any one of the advocacy points that you raised, I appreciate how you brought in some recommendations on how our viewers can get started and really figuring out the status of their state's approach. Did you have anything extra to add on there? You did amazing at really covering that earlier in the slides.
The only thing I would add is that, you know, if folks are trying to figure out kind of what's, because this is going to be a state by state thing. And so if folks are trying to figure out what's happening in their states, I would encourage you to check out your state Medicaid agency website for updates on changes to Medicaid and implementation efforts related to the work requirement. A lot of states are posting information on their websites about the status of their efforts. They often have FAQs and things like that. Sometimes you have the opportunity to sign up to be on kind of a regular mailing list to get updates on what's happening. Most agencies have social media, so folks can follow their social media accounts to get kind of updates of what's happening. And states also have to have Medicaid advisory councils that they should be using to engage both individuals, but also partner organizations. And information about those councils should be on their websites as well. They're required to have at least 2 public meetings a year where they have public comment and whatnot. So that's another place that folks can look. The last thing I would just say is this law and implementation is on the minds of all Medicaid agencies. So I would be surprised if they're thinking a lot about the reentry population, though. So I think that's the real opportunity here, is to put that population on the minds of folks in the Medicaid world. I'd be surprised, though, if this is on the minds of most people in carceral institutions. So I think that's also an opportunity to just put this issue on the radar for carceral institutions.
Sure. Thank you for that. And then Molly is asking, for the states that did not adopt the expansion, what impact should we expect and how can we best advocate? Which sounds like it could go along with what you were just discussing.
I'm sorry, was that one for me?
Yes.
For the states that didn't adopt expansion, yes. Most of the requirements in the law are really focused on Medicaid expansion. There are some restrictions in terms of provider taxes and other ways that states fund their programs. Some of those could impact states that didn't expand. So they're going to see, potentially less Medicaid dollars as well. But the vast majority of the cuts and policy changes in the law were really targeted at the expansion population. So those states that expanded Medicaid are going to see the vast majority of these impacts.
Thank you for that. And Gina, one of the challenges of access to SNAP and other assistance programs is that many individuals are not eligible for them while they're in the halfway house or local correctional facility. What opportunities exist pre-reentry from institutions to better navigate application, qualification, and recertification?
Yeah, absolutely. One of the things that states have a waiver, they could apply for this. This is an option where individuals can apply where they're at that institution and can get the support. So as soon as they leave, they can leave with their EBT card, they can leave with the benefits already in place. So they don't have to navigate that whole process, because it takes about 30 days, that whole process, while, once they are out of those venues.
Thank you for that. And I see I hope I'm saying that correctly, it says our work, training, and volunteering requirement for SNAP went into effect November 1st, 2025 in Texas. So these changes are starting to go into effect, and it's incredibly helpful to hear how we can step in, how we can advocate, how we can be informed. And I just thank you both again for your presentations and just being here. So Teresa, do you have any final thoughts before we close out for the day?
No, I see there's another question. Can states use the Rural Health Transformation Funding to help pay for their SNAP funding shortfalls? I don't know as much about the Rural Health Funding Transformation. But I'm not sure that that's going to be something that's going to be able to pay for the SNAP funding shortfalls. And Gina, I don't know if you have other thoughts on that.
Well, I actually, in terms of context, $1 trillion away from healthcare, this fund was 50 billion, which is really like nothing, in order to address this. And it gave it across the board, whether or not your state was impacted. So there were states who were like, oh, we never had this much money, but they did this application where you will get positive points. The reason why I'm giving you this background is that Secretary Kennedy really wants to got more access to SNAP. And one of the provisions that he put in there is that if you restricted SNAP purchases, if you made it more difficult in order to access SNAP, you would get extra points. So that's why we've seen a wave of states. We have 22 states that have restricted SNAP purchases because of this rural funding. Funding is good, but they made it where they force states to say, you want this money because we cost it. We're actually additional barriers. But what I would say is, look, the state agency wants to do its job. They just need the resources, and it is unfair for them that they are working overtime and but really lack capacity. So it's really pivotal for you to speak to your state legislators to make sure that they prioritize funding for the caseworkers to have the resources to do their job, because we can fix policy, but if people can't get through the door in terms of like all of these provisions, then we are failing at that. And it really is a matter of priorities within states. States have the budgets. They can figure out different progressive mechanisms in order to address and ensure that people reentering society have the resources to access both healthcare and food assistance.
Thank you, Gina. And thank you for all the questions. I know that the resources and expertise shared today will lead to a deeper understanding of our consumer rights and protections. Thank you, everyone, for joining us today. Have an incredible week, and there will be more ways to elevate your experience and expertise this coming month. And I think, yep, it's on the screen right there where you can register for further webinars and informational gatherings like this one. Thank you.